I'd now like to introduce Giovanna Imbesi, who is the person who is really instrumental in making the LACNETS organization come into fruition. She and I had been talking about this for several years and working out all the logistics to make it happen. But really Giovanna's tireless work and dedication and enthusiasm, as well as her knowledge in how to run an organization properly, just all came together to make LACNETS happen. And I think what you see today is the fruits of her labor, that this has been just become an awesome organization for helping people in the West Coast deal with their neuroendocrine tumor. So she also provides healing music and just so many different aspects of supporting patients while they're undergoing all kinds of treatments. And I think we really owe her a great big thanks. She's going to be speaking now.
Wow, and coming from Dr. Wolin, that really means a lot to me. I was a little caught off guard because I thought we were doing Q&A right now, but we will come back to the Q&A because I know that's an important part. If you have any questions, if you need a question card, I see Lindsay walking around with them now because we'll be bringing back Dr. Coons and Dr. Wolin and Ron for some questions on that segment. In the meantime, I'll give a short talk. So I wanted to address, since there were so many new people here today, I wanted to address what I call being the CEO of your health team. And, all right, large green button forwards. Or what I learned to be a better NET patient over the last 10 years. So I am a patient, and I was diagnosed in 2005, terminal ileum and with liver metastases. And I had surgery then, had my small bowel resected and also radiofrequency ablation on my liver. They took out my gallbladder as a preventative measure. And then I was just wait and watch. And it was actually in 2009 in this room, I had started to have a little progression, and right over there, pretty much where Dr. Wolin's sitting now, I met him and he said, wait, I have something for you. And that was the beginning of the clarinet trial for lanreotide. That was in 2009. And I am still on lanreotide. It's been many years. So I won't say how many injections I've gotten of that because it's not a good image. So some of the things that I've learned along the NET path, there's three things I'd like to talk about. Immediately after the diagnosis, and then sort of some nuts and bolts, and then embracing the whole person. The analogy to the CEO comes from, the position of leadership, really being the leader of your healthcare, because ultimately you are the one managing and collaborating and coordinating with all the various doctors. And you're looking at short and long-term goals, and you're also making a lot of decisions. How many people have felt like this at various stages of their treatment? In the very beginning, starting to process this diagnosis can be so frightening. You must feel like you're learning a new language. There's acronyms, there's long 5-syllable words you've never heard before. And of course, the first thing is, you're thinking, well, how long do I have? And in my case, it was like, well, you're lucky it's carcinoid, because this is, in general, a slower growing tumor. So we have the advantage of that. And But I realized early on that seeing a neuroendocrine tumor specialist was really going to be essential. And so there's a realization in the beginning, if you're seeing your local doctor and you've been fortunate enough to be diagnosed, in my case, it was more than 6 years of misdiagnosis and then being finally diagnosed, you may realize that your local doctor, as much as you love them and as experienced as they are, they may not have experience with neuroendocrine tumors. So this is time to go to a NET specialist. Then you may realize that even though you live in a large city next to a major medical facility, that they may not have a NET specialist. So there's a process in the beginning of, wow, I have a lot to learn. My doctor, who I've gone to for so many years, who's always been my go-to person, may not have the experience, and I may have to travel. So those are already some pretty big realizations, along with all of the other emotional side of getting the diagnosis. And the other part is that this is a long haul. This is not something that's going to be a few months and then you're done. I was diagnosed in 2005, so it's 10 and a half years, and I know that there's many people here who have had this for a long, long time. Can we do a quick show of hands of how many people were diagnosed in the last year? So quite a few. And how about the last 5 years? Another third. And then how many in the last 10 years? If you're in that first-year group, turn around. Can you keep your hands up, the 10-year people? Turn around and look at these hands, because it makes it a little less frightening. And then 10-plus years? Yeah. So as I said earlier, this is a great place to be because you can learn from other patients and talk with them and share with them and gain some experience. So one of the things you learn is pacing yourself, because this is the long haul and not a sprint. And building your team. So I love this slide this is from ENETS, the European Neuroendocrine Tumor Society. It is a bit older, from 2010, but I think it still really holds true with the patient sort of there in the center and all of the various team members, including, as somebody just mentioned, the pathologist. We have a wonderful talk on our website from Dr. Dipti Dal, the pathologist here at Cedars, and the pathologist really plays a key role in the treatment, even in the middle of surgery. So all of these team members are quite important. At some point, each specialty will most likely be part of your treatment. So I'd like to spend just a few minutes on nuts and bolts logistics. With a multidisciplinary team and local doctors and the fact that this is a longer period of time, that all adds up to lots of medical records. And many of you may have experienced this already. It's the paperwork alone can be overwhelming. So we're having images, we're having all of our medical records, we're getting labs. How do we keep track of all this medical housekeeping? So one of the things that I've learned with the scans, at least is true here at Cedars, after I have my MR, you can ask the technician for a disc. And if you've spent any time trying to get discs after the fact or send them around, this is one of the easiest things to do. They usually have it ready in 30 minutes. So if chances are you've been fasting, you can go eat something and come back and get the disc. And then you've got it right there in your hand. You can also go to medical records here at Cedars, and sometimes they're in the imaging center, so you can either go there before your scan or after your scan and fill out the form that very same day so that you have a medical release form on file. And then they can fax it to you. I don't think they email at this point, at least not at Cedars, but you can set up an online fax. And if you have any questions about that, Josh could probably answer those. This is really helpful. The other thing I would recommend is that you check the dates. There was recently an example of scan that was sent out. Immediately after the scan, the patient sent in the release form, and it turned out that the date wasn't correct. It was from 2 or 3 scans ago. So check the dates. You really have to just make sure that you're looking at what you think you're looking at. The other part that's really important is retention, meaning how long do they hold your records? I was just up in the medical records office, and I learned that they keep them for 10 years here, whether or not you're in treatment or not. So there was a woman trying to get her records, and she was surprised to learn that even though she's in treatment, anything from 10 years prior was gone. So someone else in the office sitting there decided to request all of their records. These are things that you want to keep on, at home in your records, whether they're on your computer. I would recommend scanning them. I like to have a folder for labs, a folder for scans, other reports, so that I can easily find them. And some of the new things that are coming out now are storage online with cloud access. And at the recent SMMI conference in San Diego, Josh Mailman actually introduced me to a company called MIM Cloud, and I spent a little time with them on the phone this week. They are doing, it's basically free for patients. So you upload your scan, you create an account, which is super easy. You upload any of your images, and then you can share them easily with someone else. All they do is you send them a request, and they send a link. So then if it's another doctor, they can just open the link and see your scans. They can also download them. Right now, I believe they're doing the first 50 images are free for patients. So I'm looking forward to getting some more information from them. I did open an account, but I haven't actually tried to upload something. This, of course, means your computer has to have a disk drive in it still. If you have a newer laptop, that might not be the case. But hopefully there are going to be more and more solutions that are going to help us with sharing our information that's on the disks. Okay, so now you've got all of that. You're starting to learn the vocabulary. You're feeling like Super Zebra. And I want to thank Nancy Marsden for her wonderful cartoon artwork. And 1 minute you feel like this, and then sometimes it changes and you don't feel so great anymore. This has been so common, this feeling of I feel great, I'm exhausted, I'm up, I'm down. The fatigue, having symptoms, and burnout. And some with carcinoid syndrome, and being not sure when you're going to feel okay enough to even go out. How do you commit to things? How does that change your social life? And maybe you're recovering from a procedure, maybe you're having side effects from a medication, or food restrictions. We've learned that we all have very different food restrictions, even though we all are under the umbrella of neuroendocrine cancer. So not knowing how you're going to feel leads to living with a lot of uncertainty. And for most of us, we're used to being able to say, no, I'll be there, I'll see you Tuesday at 2 o'clock. And then it's like Tuesday morning comes, and you're like, this is not going to happen. I just don't feel good enough. So how do you manage that with work, family, friends, and the expectation that you can continue to live your life? So what I like to look at is the whole person. And I like to say, we have 24/7, we are with ourselves, living this life with this cancer, and maybe a portion of that, a small portion of that, we're actually spending with our doctors. The rest of the time, we're spending with our own mind, trying to understand what this feels like and how to process all of this information. And I think this brings up a lot of questions about challenging questions about future and hope and dreams. How do we think about dreams? How do you think about future when you're not sure what future means? And how do you have hope for things and make plans? So I don't have any certain answers, but I think these are important questions to ask because it starts to frame your life in terms of how you're going to live your life. That, well, someday I'll fill in the blank, maybe something that comes sooner than later. Maybe you start living that bucket list no matter what. And I think that, I've heard a lot of people with cancer say, well, this has been the really good part about cancer, because I've actually turned my life around, and the priorities that maybe were in the distance are now right in my immediate future. We heard from Carolyn Katzen talking about integrated oncology. This is a favorite area for myself, and I think important in terms of immune support. What else can we do? Things that we do have control over, whether that's through healthy diet, supplements, stress reduction is a huge one. And we're going to hear a little bit about mindfulness meditation in a little while, and yoga, and your spiritual practice. And maybe, if these are things that you've said, well, I don't know where I'm going to fit that in. I'm so busy. But see how life flips around when you start making those actual priorities. And say, maybe I can do a 10-minute meditation in the morning and start my day that way. And see how it feels. So the emotional support of friends, I find that a lot of friends find it really hard to understand how you could be walking around for 10 years with tumors in your liver and not completely lose it. It's, some of us, we may have carcinoid syndrome, but all of us have that but you look so good syndrome. And it's really different to expect other people to understand what that's like, even within our families. So I ask, what rejuvenates you? And what recharges you? And can you live a healthy life with cancer? Can you be a healthy person with cancer? I think the answer is yes. I think this is something that we live with, just as so many people live with chronic conditions. And for me, rest, relaxation, creativity becomes an important part of that. And I wanted to go back to this slide from LACNETS because it's one of the only I've seen with the patient support group included in this multidisciplinary team. And one of the reasons that I started LACNETS was because there was a patient support group when I was diagnosed in 2005, and it was essential. It was the first place I went, and I met people like yourself, and they just gave me so much enthusiasm and hope that I couldn't imagine there not being a group in Los Angeles. When the wonderful woman, Nicolette Way, who started that group, passed away in 2010, we didn't have a group in Los Angeles. And in 2012, about 4 years ago, I went to Dr. Wolin and I said, can we start something? I think we need to do this. And Dr. Wolin was our inaugural speaker to a packed room in the Cancer Center. And since then, it's grown so much, and the most rewarding thing is seeing the patients connect, one patient connecting with another. I mean, there's a story here today of 200 people sitting in this room. There's two people who really needed to meet, and they happened to sit next to each other. It wasn't an accident. I mean, it just worked out that those two people met. I really believe in the connections that happen with the patients. And just briefly, there's, for the new people in the room, once you start living with this for a while and you're looking pretty good, people will think that you're done. Or they'll say, oh, but you're in remission, right? And it's like, no, I'm not in remission. Right now, we don't have a cure, but I'm managing my disease, and it can get tiring for other people who are not quite sure how you could be living with this disease all the time. So I thought you were done with that part. And finally, I just want to say that I really believe that age is a privilege. I feel that when I was diagnosed, I was 47. I had surgery at 48. So turning 50 was a really important milestone for me, not in the way that I had imagined it would have been prior to being diagnosed. I was like, oh God, I'm turning 50. But this way, it was, I'm 50 and I'm here and I'm alive and I'm going to survive with this. I think that the attitude about how you feel about age and, I just met a girl who was 17 when she was diagnosed. And it really makes a difference in the outcome of just believing that we are going to survive this, and that with all of the new things coming down the pipeline, in the 10 years I've been in this, I've never seen this kind of pace. And I think all the doctors would agree that we've never seen these kind of FDA approvals and pending FDA approvals and advances coming so quickly. So thank you so much, and I really appreciate everyone being here today. And with that, I wanted to ask everyone, just take a deep breath in and breathe out. And consider, by breathing in and breathing out, that saying, all my needs are met. That's something, if you carry it with you every breath, just you can be anywhere. Just remind yourself, breathe in, breathe out, all my needs are met. Has a very tranquilizing feeling, no matter what. Thank you so much. I appreciate your attention.